بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسوله الكريم وعلى آله وصحبه ومن تبعهم بإحسان إلى يوم الدين. السلام عليكم ورحمة الله وبركاته. Here we go again. We meet again with Dr. Zubair Saeed. This is your program. It's COVID-19 update. And Alhamdulillah, now we passed the first half of Ramadan, and we ask Allah subhanahu wa ta'ala make us live through the rest of Ramadan and many Ramadans to come and keep us healthy and safe, all of us and all our communities, inshallah. We have again with us Dr. Zubair, and he has been with us for almost 2 months now, alhamdulillah, and we're keeping up with the corona cases. As we all know, now the number has passed 4 million, subhanallah, and in the United States 1,344,000, and we have 85,000 plus casualties. So we ask Allah subhanahu wa ta'ala to keep us safe, and we like for Dr. Zubair, as you all know, he's a community health specialist. He's from Fairfax Fairfax County Health Department. He is, doing always the public health outreach and to the Muslim communities in Fairfax. And we welcome him again. Ahlan wa sahlan. Assalamu alaikum wa rahmatullah, Dr. Zubair.
Alaikum salam wa rahmatullahi wa barakatuh. Okay, so as always, we begin with the number of cases in Fairfax County is now up to 5,690. We have 921 hospitalizations and 237 deaths. Now, if you recall last week, I said the curve started to appear to be flattening. Well, guess what? Things change, and now it doesn't look to be that doesn't look to be the case anymore. Looks like we got a little bit of a jump. So looks like we're still in the experiencing exponential increase of illness in Fairfax County. So the curve jumped back up basically. And so we're continuing to see an increased number of cases and deaths in Fairfax County. So the natural question in some people's mind is what's going on, especially with the lockdown the way it is. Why are we still seeing this? There's a few reasons. So number one, we're definitely seeing active community-wide transmission. That's not anything new. We've been saying that for a number of weeks now, but we're just basically seeing that community-wide transmission is increasing, particularly in nursing facilities and in crowded conditions. But I do want to mention that 75% of deaths in Fairfax County have occurred in nursing home facilities. So I think that's important to note. But and so the health department has sent out multiple teams to investigate and to control and to mitigate these problems in nursing homes. Okay, so that's one reason. And a second reason why we're seeing a continued increase in cases and deaths, commercial lab capacity is continuing to increase. So basically, the more people you test, the more cases you're going to get. And we're seeing that nationwide, but of course we're seeing that in Fairfax County as well. And then number three is that who is being considered a case of COVID. So before it was just laboratory confirmed case, but now they're also counting probable cases in the tally. So meaning that if a doctor sees that you have symptoms of COVID-19 and you have a history of being exposed to someone who has COVID-19, then you also get counted in that official tally. Whereas before, they weren't doing that. They were just going by lab test only. So because of that, because of these three reasons, that's why we're seeing an increased number of cases week to week. Okay. I also wanted to mention that according to a study out of the University of Virginia, for every confirmed case of COVID-19, there are 6 other cases of infection. So it's estimated that in Fairfax County, we have about 35,000 probable cases of COVID-19 in the county. That means about 3% of the population in Fairfax County has been estimated to have been infected. Statewide news, Governor Northam, he has announced his blueprint to reopen Virginia. So it's expected, although this could change, that there'll be a slight phase 1 reopening of the state of Virginia starting Friday, May 15th. And he's basically following the guidelines set forth by the CDC. But let's get into a little bit of the details. I know somebody also asked about this last week, and so this past week, the governor released some details. So phase 1 reopening will kind of look like this. In the first phase, restaurants, retailers, gyms, barbershops, hair salons, movie theaters, and farmers markets will be reopening with limited amount of customers, and they will be also practicing enhanced cleaning and continued social distancing. Now, the state, I think in the coming week, the state is going to issue even more specific guidelines for different kinds of businesses. So stay tuned for that. But basically, in this phase 1 reopening, some things are going to remain consistent, like no gatherings of more than 10 people. That's not going to change. Continued social distancing, continued teleworking, and continued face coverings are going to be recommended in the workplace. And businesses are going to need to follow physical distancing, enhance workplace safety, and cleaning and disinfecting. Retailers, they're going to reopen at a lower capacity. Some gyms may reopen as well, but there's going to be fewer customers with more enhanced cleaning and more frequent cleaning. Now, phase 2 and phase 3 are the next phases after phase 1, but you won't get to phase 2 unless you see continued downward trend in the data, meaning you see a downward trend in number of cases and hospitalizations. And then if it stays that way in phase 2 for some time, then it will proceed to phase 3. But I also want to emphasize that just because you get to phase 1 doesn't mean that we can't go back. And if you get to phase 2 and phase 3 doesn't mean that you can't go back to phase 2 and phase 1. It all depends on what's going on, what's the data showing. Is there a downward trend of cases and hospitalizations? If so, we proceed to the next phase. If not, we see an increased number of cases and hospitalizations, then we go back to the previous phase. And that's definitely a possibility. Okay, testing information. So we've been talking about testing almost every week. Basically, there's 2 different types of tests that we've been talking about. One is the diagnostic test to see if you have an active infection. That's usually called RT-PCR test. It still has a limited sensitivity, about 40 to 60%. So we still have a lot of false negatives. Fairfax County now has a plan they have a goal of providing 2,000 of these tests per day. And they're moving toward that goal. And they're going to prioritize increased testing in neighborhoods that have the higher amounts of known illness. And the other test is the serological test, which tests for antibodies in the blood. As we've said before, antibodies, of course, are proteins that are formed when somebody recovers from an infection, like a coronavirus infection. They form these antibodies which help them fight off a future infection. So these tests are still not very accurate. They are vulnerable to cross-reactivity with other coronaviruses, leading to false positives, meaning that, for instance, antibody test may say, oh, you're positive for having coronavirus antibodies. But are those antibodies specific to this novel coronavirus or to other coronaviruses? Because remember, we said there are other coronaviruses out there as well, particularly coronaviruses that cause the common cold. So sometimes these tests may have like a false positive because, yeah, they are recognizing or picking up antibodies, but maybe not antibodies for novel coronavirus, but antibodies from other types of coronaviruses. So there's still issues with antibody tests. They're not, 100% reliable. So you can, if you want, if you have access to a doctor, you can go to your doctor and ask for antibody tests. They're out there. Labs are conducting them. But I would say because of accuracy issues for now, they're not very reliable, and it's probably best not to rely on them for now. That can change, and I hope it does change, but right now there's just kind of too many accuracy issues. Now, in other testing news, in a move that could significantly expand the nation's testing capacity, the FDA has now approved a new type of test that people can do at home. It's expected that that results can be acquired from these tests as soon as 24 hours after the specimen has collected and arrived at a lab. Now, the Gates Foundation is moving to jumpstart these efforts. It is developing an app that could be used to order test kits, deliver lab results, and assist with contact tracing. And so their goal is to produce kits that cost under $5. Now, no matter if you test positive or negative with either the diagnostic RT-PCR test or the antibody test, the bottom line is we should all practice or continue to practice preventive measures, even if you test negative, just because of the, as I aforementioned, issues with accuracy of some of these tests. Now, a new study found that coronavirus particles have been found in the semen of men, but this doesn't necessarily mean that this novel coronavirus can be transmitted sexually. Definitely more research needs to be done into this matter, but we just don't have enough information to say that that is the case yet. As we've said before, this is a disease that is affecting predominantly older people as well as people who have underlying health conditions. Children are not as susceptible, but that doesn't mean that a child can't get infected. And it certainly doesn't mean that once they get infected, they can't transmit the disease. They definitely can. Some studies have now shown that closing schools has a significant impact on preventing the spread of coronavirus disease. So that's just another reminder that all of us need to do our part to prevent the spread of disease, even though kids, for the most part, don't get severely impacted, although there have been, unfortunately, some cases of death even among children, especially maybe perhaps linked to this Kawasaki-like disease syndrome that we talked about last week. But for the most part, they don't get hospitalized or die because of COVID-19, but they can spread it. And so I just wanted to clarify that because some people wonder about that, but children can definitely spread disease just like adults can. How about mental health and COVID-19? So there's definitely an uptick in mental health cases, particularly depression, substance abuse, post-traumatic stress disorder, and suicide. So it's expected that these numbers, unfortunately, are going to continue to increase as this pandemic goes on. Research has established a strong link between economic upheaval and suicide and substance abuse. For instance, a study from 2009 during the Great Recession that began in late 2007 but continued for another year and a half found that for every percentage point increase in the unemployment rate, there was about a 1.5% increase in the suicide rate. And frontline workers, particularly healthcare providers, grocery store workers, delivery people, they are also considered to be more prone to mental health problems in this pandemic. So definitely stay tuned to that. I think you're going to see that this is going to be a continuing problem as this pandemic goes on. My suggestion is to be open with your feelings of stress. Be open to communicating these types of feelings with family members and friends. And please seek professional help if you see that your condition is worsening. Definitely you want to stay tuned for more information because I definitely think things are going to get worse on the mental health front. You probably heard of this thing called COVID toes. What are COVID toes? I just wanted to just briefly cover it. So COVID toes, that's the term that's loosely being used to refer to a type of lesion that appears in some patients who have COVID-19. It appears on their toes and their feet. So they're like purple and red, pink, blue lesions that appear on the feet of some patients who have COVID-19, or even after they recovered from COVID-19, they get these lesions resembling chilblains. Chilblains are like lesions that some people experience in response to cold. like frostbite-like rashes on the toes. So this is appearing in some patients who have COVID-19 or who have recovered from COVID-19, particularly in children. And it's thought to be caused by an inflammation of the blood vessels or even clotting of these blood vessels that temporarily decrease blood circulation. The good news is that these lesions are not really considered to be very severe or serious. They usually resolve on their own within a few weeks without the need of any treatment. Some treatment can be provided, but it's usually not required, and they usually resolve on their own. But it's just another interesting sign that we're seeing in some patients of COVID-19. Another very bizarre finding that we are seeing in a lot of COVID-19 patients, particularly in the hospital, is something called silent hypoxia. Hypoxia simply refers to the fact when someone is very low with their blood oxygen levels. So what we're seeing is that some of these patients who have severe illness due to COVID-19, they come to the hospital, and the doctors, they check their blood oxygen level, and they're very shocked to see that it's very, very low, so low that they wouldn't expect them to be, just kind of sitting there talking on their phone and chatting. Usually people who have such low blood oxygen levels, they're in distress. But these people, they paradoxically, they're just showing up at the hospital, and they outwardly feel as though there's nothing wrong with their oxygen levels, but it's a big problem. And the reason it's a big problem is, of course, all the tissues in our body need oxygen, and the body seems to adjust to these very dangerous levels of low oxygen levels in some of these COVID-19 patients in the hospital. And that's not good, because the brain depends on oxygen, other tissues in the body depend on, everything depends on oxygen in the body, and it can cause damage to the body, and the person doesn't even know it. One way that they compensate unknowingly is that they start to take more rapid or deep breathing, and the patient doesn't realize it. And this can also damage the lungs, and it's one of the reasons they have to be put on a ventilator. It's a very interesting phenomenon that we're calling it silent hypoxia or happy hypoxia, because paradoxically, these patients should not be well enough to be talking on the phone, but they are, because their bodies are somehow adapting to this COVID-19 disease in a way that's really perplexing a lot of doctors. I wanted to mention a note about pulse oximeters. What are pulse oximeters? So a pulse oximeter is a non-invasive way to monitor a patient's blood oxygen saturation level. Some doctors are using it to monitor a patient's blood oxygen level when the patient is at home, because they're isolating. But there are some questions that remain about the merits of this type of device. A number of these devices that are available on the market, they may not be accurate. For instance, a 2016 study found that only two out of 6 popular oximeters met the criteria for accuracy. And in addition, people can misuse these oximeters. That can affect the readings. You have to wear the device exactly correctly. Your hands have to be at room temperature. You can't have dark nail polish on, and even holding your breath can affect the level that the oximeter is reading. So these devices are not perfect, but some doctors use it as a way to, as I said, monitor oxygen levels in a patient. So again, check with your healthcare provider if you happen to have COVID-19. If you have a diagnosis of COVID-19 and you're under the care of a doctor, you can ask your healthcare provider more about that. How about coronavirus mutating into different strains? Is this happening or not? So if you recall from last week, I said that there was this study that said that it looked like the coronavirus is mutating and perhaps even affecting its ability to infect people at a greater level. In other words, the other strains that are mutating are becoming more infectious. Well, it looks like that may not entirely be true. Now, I want to, because a lot of information that we're getting is changing, and a lot of people are also debating. You have experts who take one side, and then you have other experts who take another side. And we're seeing this a lot with this pandemic. So Now, this coronavirus is definitely changing. There's no doubt about that. Now, are those changes enough that it qualifies something to be categorized as a new strain? That's being debated. Some experts are saying, no. There are no all of these strains. There are no multiple strains of coronavirus. Other people are saying, no, there are enough changes that it does categorize it as a new strain. So this is something that is debatable. Also, they're looking at that previous study to see that if there are problems in the way that study was done, that definitively said that, that there are more strains and that these strains are more dangerous. So it looks like there's a debate on whether these quote unquote new strains are dangerous or not, are more dangerous or not. But the bottom line, it looks like the consensus by most experts is that there are not new strains of coronavirus, and that all the coronavirus infections are similar enough that they fit under the umbrella of one strain or maybe two strains. And it's not necessarily true that one strain is more dangerous than another. But again, that information could change, and it's interesting to see that public health experts or virologists are debating this. So it's not agreed upon 100% by everyone. But I just wanted to point that out. Okay, I wanted to now go on to some exciting information about treatments. A new study has shown, a pretty large study has shown that blood thinners can help the very sickest of COVID-19 patients in the hospitals recover. If you recall, last week, we talked about how clotting is something that we're seeing in COVID-19 patients, in some COVID-19 patients in hospitals, and that clotting is leading to heart attack and stroke in particularly young patients, like they're in their 30s, 40s, and 50s. So some doctors are now giving those patients blood thinners to prevent the formation of clots. And in this large study that was done in New York City's Mount Sinai Health System in mid-March, they found that mortality, so the death rate, it fell from 62% down to 29%, and median survival jumped from 9 days to 21 days. So it was a significant study that shows that blood thinners can be effective, but of course more research needs to be done. And doctors always have to weigh the dosage of blood thinners, because blood thinners can be effective in preventing clots, but then the downside is if you give too much of the blood thinner, then that can lead to bleeding. So it's always a balance, and of course more research will figure out all of that. Monoclonal antibody therapy, what is that? So you probably heard by now of using convalescent plasma therapy, meaning you take the blood of someone who has recovered from COVID-19, right? And they have antibodies, and you use that blood and you inject it in someone else so that they get injected with those coronavirus antibodies and fight off an infection. This is a very old concept. It's not new to this pandemic. It's been used in other diseases, and it's being used in this pandemic too. But now there are studies underway to use monoclonal antibody therapy. What they basically do is they take a bunch of the antibodies, researchers, they take a bunch of the antibodies, and they sift through which antibodies are more potent or more effective than others. All the antibodies may not be equal and how effective they are. So they pick and choose the more effective antibodies, they isolate that, and in the lab they clone it in large numbers. And they can use those cloned antibodies, and they can use that to treat patients. And that's a very significant development. Of course, monoclonal antibodies, though, are not new to even this pandemic as well. Other diseases like HIV, lupus, multiple sclerosis, various forms of cancer, they also use this type of therapy. And it looks like it's going to be used in this pandemic as well against coronavirus, and they're going to do research to see how effective it is. But that's another promising treatment in the battle against coronavirus. I mentioned before in previous weeks about something called a cytokine storm. If you recall, again, really briefly, that's when the immune system overreacts to an infection, and that overreaction results in damage to other organs in the body. So one of the chemicals in as part of the immune response or the immune system is something called cytokines. And these are chemicals that are part of the immune system response. So researchers are now looking at blocking these cytokine inhibitors or cytokine blockers as a way to treat coronavirus as well. Of course, the danger is if you suppress the immune system too much, then it can't fight off the disease. So again, that's another balance where you want to inhibit the right cytokines, because there's many different types of cytokines, and you want to make sure that you don't inhibit it too much so that you are leaving the body defenseless against infection. So, but this is another promising area of research. Some early studies have shown that this could possibly be effective. So stay tuned for more research on that. Could male hormones affect COVID-19 severity? So researchers in Italy, they have discovered something very interesting. So androgens, which are male hormones like testosterone, they have found that testosterone in male hormones, it could affect severity of COVID-19 illness, and could be one reason why this disease seems to be affecting men more severely than women. So in this study from Italy, they found that they were treating patients with prostate cancer using androgen deprivation therapy. They're basically inhibiting male hormones as a way to treat prostate cancer. And what these investigators found is that these patients who are on this male hormone suppressive therapy because they had prostate cancer, and those patients, they found that they were less likely to have severe illness or be infected with COVID-19. And they published this research in the Annals of Oncology on May 7th. And it could be it could be a reason why we're seeing more severe illness in men compared to women, namely because these male hormones like testosterone seem to affect the virus's ability to infect cells. So definitely there's going to be more research into this as well. And I just thought it was an interesting find, and that was out of Italy. I wanted to touch upon vaccine development. There are a lot of vaccines that are currently being developed. So I wanted to just briefly cover the different phases in vaccine development. So in phase 1 of vaccine development, you have a few dozen study subjects. And in phase 1, they mainly look at the safety profile of a vaccine. In phase 2, they look at a few hundred study subjects. And in phase 2, you're looking at not just safety, you're also looking at dosage and the immune response. And then in phase 3, you're looking at a few thousand study subjects, and they look at the effectiveness of the vaccine. Now, normally it takes years to get to phase 2. But a vaccine being developed by Moderna is already at the phase 2 stage, which is unheard of. And so some public health experts, including Dr. Fauci, have said that it could be possible that they have a vaccine by January. Other public health experts disagree and think that we won't have a vaccine until the end of next year. And again, no one really knows for sure if we'll get a vaccine or when. But I just kind of wanted to make people aware of what the process usually is like. Currently, we have 8 vaccine candidates that are in clinical trials right now. Some of these trials are being conducted in China in the United States, and one trial vaccine candidate is they're doing a trial in the UK. But 100 additional vaccines are currently in the lab phase. So there are a lot of vaccines being tested. Now, some of these vaccines are going to be mass produced at the same time they're being tested, which is not what they usually do. But they're doing this in an effort to get out and distribute a lot of vaccines in the event that a vaccine turns out to be effective. Okay, so basically, to sum up, our response to this pandemic is not a sprint, but it's indeed going to be a marathon. It's not something where we're going to see a peak and then it goes down and that's it. It's going to be a marathon, and we might be shifting from phase 1 to phase 2 and back to phase 1 to phase 3 and backward. And I want people to expect that's we could get to that, and we could get to a position where we're in phase 2 and then we have to go all the way back down to a lockdown. I mean, so this is definitely a marathon type of outlook. So anyways, as always, just remind everyone to continue to stay at home, socially distance yourself, wash your hands with soap and water for 20 seconds, cover your coughs and sneezes into your sleeve. Avoid touching your eyes, nose, and mouth. Isolate yourself if you have symptoms of COVID-19, and quarantine yourself for a period of 14 days if you have been in contact with someone who has COVID-19. Jazakallah khair.
Barakallah feek, Dr. Zubair. This is like a wealth of information, that knowledge that we gained today. So I have a few questions. The start with the test. The FDA approved first at home testing.
Yeah.
The kit, what is that? Rutgers lab.
Yes.
Yeah. So is this something that anybody can get, or is it has to still go through the provider to order this for certain patients?
Well, it says scientists and public health experts are hoping that the guidelines will include ordering online and purchased at a pharmacy without a doctor's order. So that's what the report said. Let's see how that goes. But that's what it said.
That's great. Now, I see from the, you mentioned about the blood thinners, and I saw on social media there were some autopsy reports from Italy. They're talking about like doing autopsies. They found this intravascular clottings and all these things. And the question is, I know this may not be addressed, but this is just a thought that on people's mind. People who are currently on blood thinners, or what type of blood thinners are we talking about? Is it like you really, there's so many classes. For example, aspirin is so handy. Is that something of help to your knowledge?
Yeah, I mean, there's been some discussion of people taking baby aspirin, which is not like taking baby aspirin every day. Which is not a crazy idea, but I always caution people to always talk to your healthcare provider. Of course, consult with them. Of course, yeah, there are different classes of blood thinners, anticoagulants. So I always just caution people, just consult with your healthcare provider about which one to take, if you need to take it at all. But I just pointed that out to basically say that this is a type of treatment that's being used, particularly because of the discovery that we are seeing clots in certain patients. So they are trying to fight that by using blood thinners. And this very large study that was done, significant study that was done, showed that it actually does lead to recovery. So that's all. But but as far as the study, which anticoagulants they use, which blood thinners they use, that I'm not sure which ones they use. But
that's really very interesting. I mean, aspirin is widely used for other indications, including prophylactic, clotting for certain subgroup of people. The other question is, any follow-up on remdesavir? Any new updates on that?
Yeah, well, not an update. I mean, it's they're getting it out to the doctors. There's been some complaints about doctors not getting it in some places in a timely way, and the distribution of it. Of course, they have to ramp up production, which they're doing. But again, remdesavir is only being used right now for the very sick patients in the hospitals on ventilators to help them recover and get off the ventilator sooner. And it's not a cure-all, of course, but it's just the kind of the first major drug, I would say, in the coronavirus toolkit. But other than that, I don't have really an update about it, other than just there's been some problems and complaints about distribution.
I see. I have a question here that says, I heard the governor will allow worship places to resume services at 50%. he's written drive-through worship. I'm not sure what is that. What would be your professional opinion in reopening masajid?
Now, I don't know. I've been following that very closely, of course. I don't know what that person is particularly referring to because, as far as I know, yes, houses of worship may reopen next week, next Friday, but I don't think it's going to affect that rule of 10. In other words, there's not going to be gatherings of more than 10 allowed. That's my understanding, but there's going to be more detailed guidance about that. What do I personally feel? Of course, the governor of Virginia is a physician himself, which I think is good in this situation. I think that I don't think he's going to allow houses of worship to have like mass gatherings. No, and I don't think it's a particularly good idea at this point. As particularly, I shared with you the numbers earlier about the number of cases in Fairfax County are continuing to increase. And that's the same situation with this whole national capital region, the Washington, D.C. area. So, which is a little bit different than, actually not a little bit, it's very different than the rest of Virginia. We still have the most number of cases and deaths in all of Virginia. And so we're in a different situation than the rest of Virginia. So I think that for now, going back to whatever we had like a few months ago in terms of houses of worship, masajid, is not really advised at this point in time in this area.
Yeah, especially the way we pray is like everybody is like close to each other and all this, so that might make it a little bit difficult. Now, you said in Fairfax we have large number of cases. Any hot area, because Fairfax County is really like different cities. Any hot area or hottest area you would classify?
Well, if you go to the Fairfax County Health Department website, and I shared this whenever it was, a couple of weeks ago, they have now a dashboard where you go and you can click and you can see the number of cases by region within Fairfax County. Now, they've done it in a kind of a strange way. They've grouped zip codes together, so you can't see it by zip code on the Fairfax County Health Department website. They've grouped zip codes together. What I can tell you in looking at that, because I look at it all the time, the central part of Fairfax County, like the part I'm in, Burke and Fairfax and Centreville, and then going up all the way, like it's a very strange combination, but going all the way up to like Reston, Herndon. This area is the hotspot for the county. We have a higher case rate compared to rest of Fairfax County. Now, if you go to the Virginia Department of Health website, interestingly enough, the VDH website for the state, they have case rate information by exact zip code. So you can type in your zip code and they can tell you what the case rate is for your zip code.
Interesting. I don't have any more questions, and I wanted to thank you so much for this great information, great update. We appreciate your time. We know you're very busy, and we appreciate you getting back to us. We hope that we can meet with you again next week, inshallah. Sure. So that's wonderful. On behalf of our community and the ICNA community at large, we thank Dr. Zubair Saeed for his valuable time and advice that he has been with us all the times here, and we hope that we will see him again, and inshallah we pray for all of us to stay healthy and stay well and do our part. As Dr. Zubair says, don't lower your guard, even though the society and the community is going to be in phase 1 soon, but the pandemic's still around, and we have to do our part to make sure the numbers are low. We ask Allah subhanahu wa ta'ala to help us do that and keep us healthy again. At the end, we ask Allah subhanahu wa ta'ala to accept our siyam and our qiyam and accept all our good deeds. And we on the hope to meet with you again next week. Jazakumullah khair wa sallallahu ala nabiyyina Muhammad wa ala alihi wa sahbihi ajma'in. Wassalamu alaikum wa rahmatullahi wa barakatuh. Barakallah.